Surgery. Surgery is a common treatment option for mesothelioma, especially if the cancer is diagnosed in early stages. The main types of surgery for mesothelioma are pleurectomy, decortication, PD. This surgery aims to remove the thin layer of tissue that lines the lungs and chest cavity, pleura, that has been affected by the cancer. The doctor will also scrape away the lining of the chest cavity, decortication. PD is a challenging operation due to the proximity of vital structures near the pleura like the lungs and heart. It carries a risk of bleeding, inflammation and leak of air or fluid after surgery. However, it can help prolong life if performed early before the cancer has widely spread. Extrapleural pneumonectomy, EPP. This highly invasive surgery involves removing one entire lung as well as the surrounding lymph nodes, the linings of the chest cavity, and layers of muscle between the ribs. The remaining lung is expanded to take up the entire chest cavity. EPP is reserved for early-stage cancers with no spread beyond the chest cavity and may help improve long-term outcomes. However, the operation is difficult and carries greater risks than PD, including potential lung and cardiac complications due to the extensive surgery. Radical surgery. In this type of major surgery, the surgeon will try to remove all lesions and tumors in the chest along with portions of the diaphragm, pericardium or even part of the heart that are invaded by the cancer. Significant post-surgical complications can occur with such extensive procedures which aim at complete cancer removal. Recovery is longer. Radical surgery may provide some survival benefits if all the cancer is removed, but this is often not possible. Debulking surgery. When the cancer is too widespread at diagnosis or has recurred, the goal of surgery becomes debulking or cytoreductive surgery. In this type of operation, the surgeon aims to remove as much of the visible tumor burden as possible to provide relief from symptoms and possibly improve drug delivery and effectiveness. However, complete removal may not be achieved. Radiation therapy. Radiation therapy, also called radiotherapy, uses high-energy rays or particles to destroy cancer cells. It is a mainstay of treatment for mesothelioma and is often used along with surgery and/or chemotherapy. External beam radiation therapy. This type of radiation treatment involves a machine external to the body that aims a precise beam of radiation at the cancer sites. It is commonly used to treat mesothelioma in the chest wall or diaphragm that cannot be surgically removed. It can also be given after surgery to destroy any remaining microscopic cancer cells and reduce the risk of recurrence. Intraoperative radiation therapy, IORT. Here, an intraoperative radiation delivery device provides a single high dose of radiation to the tumor bed during surgery while protecting surrounding normal tissues. IORT may help control the cancer and is being studied for use in mesothelioma. Proton beam radiation therapy. Proton therapy is a type of high-energy external beam radiation that may cause less damage to surrounding normal tissues compared to X-rays. It utilizes protons rather than X-rays to treat cancer. This allows the radiation dose to decrease more abruptly beyond the tumor. Proton therapy delivers radiation from outside the body similarly to stereotactic body radiation therapy and is being studied for use in mesothelioma. Chemotherapy. Chemotherapy uses anti-cancer drugs to destroy mesothelioma cells. First-line chemotherapy. The main first-line chemo regimens used for mesothelioma include a combination of pemetrexed, Alimta, and cisplatin or carboplatin. These drugs are given intravenously every 3 to 4 weeks for up to 6 cycles. This combo has been shown to improve survival compared to cisplatin alone in clinical trials. Other options include Raltetrext, Tomudex, or gemcitabine instead of pemetrexed. Second-line chemotherapy. For mesothelioma that continues to grow after first-line chemotherapy, second-line options may include vinylbine or gemcitabine. Clinical trials are also an option. However, second-line chemo response rates tend to be lower. Neoadjuvant, adjuvant chemotherapy. This involves chemotherapy given before, neoadjuvant, or after, adjuvant. Another main treatment like surgery, to potentially shrink tumors prior to surgery or kill any remaining microscopic cancer cells post-surgery. This approach is being studied in clinical trials. Immunotherapies. Immunotherapy is another treatment modality for some mesothelioma cases. It aims to boost the body's own immune system to fight the cancer. Anti-PD-1/PD-L1 drugs. Immunotherapies such as nivolumab, Opdivo, and pembrolizumab, Keytruda, that target the PD-1/PD-L1 pathway have shown promising results for some mesothelioma patients who previously received chemotherapy, with response rates of around 20%. They tend to have fewer side effects than chemo. Vaccines. Treatment vaccines aim to teach the immune system to recognize mesothelioma cells. They are still under investigation but may benefit some patients in the future. Vaccines like rendipepimut combined with other therapies are in clinical trials. Adoptive T-cell therapy. In this immunotherapy approach, T cells are removed from a patient's blood and engineered in the lab to target specific antigens onto cancer cells more precisely. They are then infused back into the patient to seek out and destroy those cancer cells. This is a novel approach undergoing clinical evaluation. Immune checkpoints inhibitors. Beyond PD-1/PD-L1 inhibitors, additional immune checkpoints that cancer might use to evade the body's natural defenses are also under exploration through clinical trials. These include therapies targeting LAG-3, TIGIT, TIM-3 and others. Targeted drug therapy. A number of the targeted drugs that interfere with specific cancer-driving molecular pathways are also being studied in clinical trials for mesothelioma. Angiogenesis inhibitors. These target new blood vessel growth to starve tumors of nutrient, oxygen supply. Drugs like bevacizumab, Avastin, have shown promising effects in combination with other therapies in early clinical testing for mesothelioma. EGFR inhibitors. Epidermal growth factor receptor is implicated in some mesothelioma growth. TKIs like erlotinib, gefitinib are being explored as targeted treatments. mTOR inhibitors. The mTOR pathway plays a key role in cell growth for many cancers. Agents like temsirolimus that target mTOR are under clinical investigation. Hedgehog inhibitors. The hedgehog signaling pathway has a role in mesothelioma development and recurrence. Drugs like glasdegib that inhibit this pathway are in early studies. FGFR inhibitors. Fibroblast growth factor receptors may drive mesothelioma in some patients. Newer targeted drugs such as infigratinib are being tested. MEK inhibitors. Agents that target the MEK protein in the MAP pathway, such as cabimtinib, are being evaluated in clinical trials as well. No single treatment is always best, and treatment planning involves weighing the risks and benefits of surgery, radiation, chemotherapy, immunotherapy and targeted drugs based on the type, stage and molecular characteristics of the specific mesothelioma. A multidisciplinary team approach is critical to the management of this cancer.